The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Good afternoon. This is Dr. Tom Roselle Live, and no, this is not Dr. Tom. This is Sue Roselle sitting in for Dr. Tom. He's off getting smart this weekend. And I welcome you to our program today. We would love to take your questions on any health questions or problems that you may be concerned about. You can call us at 888-630-9625. That's 888-630-WMAL. And we are specifically talking today about a very timely program considering the weather, and that is spring allergies. As of last weekend, a lot of people are taking a real nosedive with the problems with the atmosphere. Between all the wind blowing the mold around from last weekend and the dust and all of our trees and flowers beginning to show up with their beautiful flowers quite early for this year, a lot of people are beginning to already start suffering with these things. And so we're going to talk a little bit about what causes the problems, why people feel so lousy with it. And I have a guest with me today, and this is Dr. Leonard Poe. And he and Dr. Roselle on Thursday are going to be making a presentation on springtime allergies at Core Concepts Chiropractic in Broadlands, Dr. Poe's office. Hi, Dr. Poe.
Good morning, Sue.
How are you?
I'm good. How are you?
I welcome you here today and look forward to having people show for your lecture on Thursday evening. And it's at 7 o'clock, is that right?
That's correct. It's going to be 7 o'clock in the Broadlands area of Ashburn.
You want to give them the address on that
Sure.
one?
It's 42882 Truro Parish Drive, but if you just go to our website, core to Chiro, the number 2, chiro.com, you can register there or call us at 703-723-4178. And we're going to be talking about allergies and what you can do about them.
Yeah, that's really a big problem right now.
We're about 30 days ahead of time as far as allergies go, as far as springtime goes. The pollens are starting to come out. The molds are out, and the weather's been kind of up and down. And, yeah, that storm that we had, that nor'easter, it really blew a lot of stuff up in the atmosphere.
It did. A lot of people were suffering this week in the office.
Yeah, this past week, if you have tendencies towards sinus pressure, sinus infections, headaches, migraines, allergies, this last weekend was rough, and the week was rough for you.
It was. And if you happen to have a tree come down your yard, that was rough, too.
That made it even worse, yeah.
I think everybody
we have a back problem.
Yeah. I think everybody has their power back, I'm hoping, anyway. So let's get into some discussion about these allergies. Why is it that so many people are suffering from them? What's the triggering mechanism here?
Well, a lot of people have, allergies are kind of a normal thing, in the sense that, we breathe stuff in, it gets in our mucous membranes, and it shouldn't be there, and, the body tries to get rid of it. It's that exaggerated response that we have that is really the problem. We have this huge histamine response. We get nasally, we get stuff, it drains down into our lungs, we get lung infection, things like that. It's that expanded and that over-the-top kind of response that we have that gives people trouble. It's not like the trees have changed. The trees are the same trees that have been here for, centuries. The reason why people start having these problems is because their immune system's changed over time. Their stress levels have changed over time. Right. We've changed, not the trees. So when we start seeing these things, then we have to start looking at ourselves and saying, okay, well, what's going on inside me? What's my stress level like? What's my eating habits like? What are all those different things? How's my immune system working? Because those are the things that factor into how well my body's going to respond when these pollens and these molds and these things start to come out and start to get inside us. Mm-hmm.
A lot of the time, I find that when people are extremely exhausted, they have a really, really, really tough time during the allergy system because they don't have the strength of their bodies. Fatigue is probably one of the biggest things that can lead you into allergies, and that's the oxymoron, because one of the symptoms of high allergies is fatigue. Mm-hmm. So it's a vicious cycle. Goes back to adrenal function, which is the king of regulating a lot of our hormones and our endocrine system, and also plays a major role in our immune system and its reaction to things in the environment that our bodies don't like. And that's part of where we get into the trouble with the histamine. And, of course, one of the things that happens whenever we have irritation is that the mucus lining of our sinuses and nasal passages gets swollen, and it starts to push a lot of mucus out to try to wash the junk out. But unfortunately, there's very small little drainage holes, if you will, from our sinuses into the nose. And once the swelling begins, it shuts those drainages off, and your face becomes a petri dish. And now you've got, this massive face headache, and it actually can reflect back up into the head as well.
Yeah, sure. And we tend to look at the endpoint piece more than we do the process. So we have tendencies towards sinus infections. Well, no, you have tendencies towards sinus inflammation, and that's really the problem. The endpoint is the infection.
Right.
If you can get that inflammatory process down, or you keep it from ever happening, and that's really the trick, if you can keep it from happening in the first place, you're not going to get an infection. But it's that inflammation. It closes off those passages. It allows things to grow, and then we have a sinus infection. We have a chest infection, things like that.
Yeah. So, obviously, you're a chiropractor. So how is chiropractic related to helping people support their immune system, support their body, so they aren't going to end up with this horrible allergic response we get every spring?
Sure. So, I mean, there's two big pieces to that. The one kind of obvious piece with the chiropractic portion is that especially when we look at the upper cervical vertebra of the spine, we look at all the cranial bones, we look at the nasal passages. With chiropractic, you can open those things back up. You can adjust the skull bones. Cranial adjusting is very gentle. It's not what we normally think of when we think of chiropractic care, but you can open up those cranial passages. You can get those things to drain out. I've done a lot of cranial work over the past week with patients because there's been so much sinus. The barometric pressure went up, the pressure inside your skull goes up.
Sure.
So if you can open up those passages and get those things to drain out properly, that pressure will come back down. So whether you're talking about sinus pressure, ear pressure, any of those things, going in and adjusting those skull bones, adjusting those upper cervicals, those things will help to get those passages to drain better so you don't end up getting things stuck and getting the infection. The other big piece with that is that just by adjusting the spine, you're going to ramp up the immune system. You get changes to neurotransmitters, you get changes to immune chemical mediators, hormone patterns, all these different things. So it actually has the effect of doing things like bringing down blood pressure, for example, helping to increase the immune response, normalize the immune response, I should say. So you get different advantages just from that simple chiropractic piece.
Just the stimulation.
Just the stimulation, sure.
From getting those nerves freed up.
I'll tell you, I mean, the number of patients this week, that have come in with sinus pressure, with headaches, with migraines, just doing simple things like moving the palate, opening up those nasal passages, getting those things to drain out. I mean, it's like immediate relief.
Sure.
I feel 10 times better already just getting off the table.
One of the symptoms is this insatiable sneezing and coughing, and just the pressure that goes on with sneezing is enough to blow out your cranials.
Yeah, sure.
And some people cough and sneeze hard enough that I'm sure it dislodges, I guess that's not the word, but alters the position of first two cervical vertebrae.
Mm-hmm. Absolutely. And then all the coughing and the hacking and everything else. And so there's a lot of structural things that happen along with that at the same time. And then there's the whole other chemical side of it that, we're coming off the holidays. Still, people's eating habits aren't the best.
Right.
They
don't
clean it up.
Day.
Yeah, if they don't clean it up quick before spring, that really impacts their immune system at the same time.
It does, and that's one of the things that I work with a lot with folks when they have the allergy issues is and they have a hard time making connection between, well, why if I eat these foods do I have my allergies worse? Mm-hmm. Well, it goes back. Any pressure that you put on the system, any overlay of additional stress to the body just further weakens your ability to accommodate changing environmental situations. So it's like from Halloween through New Year's, everybody blows things out of the water. Why do I get the flu always in January? Well, that's why, because they've completely obliterated their immune system over that 8-week period, to the point that they can't relegate the white cell enough to fight off the viruses. The viruses are there all the time. It's just you're more susceptible at that point. This time of the year, we've gone through the winter. There's a lot of stress for people trying to get around in the cold weather, trying to get around with the bad roads, if we have bad roads, or the threat of bad roads. I mean, the Weather Channel makes this the topic of the century every time there's a possibility of a snow flurry. So people are all stressed out and emotional. Oh my gosh, I got to drive in the snow tomorrow.
No, you don't. They're going to shut down the government anyway. Schools are going to be closed. The government's going to be closed. Everything shuts down anyway. I don't know why we get worried about it.
So you've got a lot of emotional stress along with, again, people still use food as comfort. And it's not broccoli and chicken that they're going to for comfort. They're going to the sweets. They're going to the ice cream. It's gray and gloomy outside. It's cold. I'm going to go get hot chocolate and a donut. All right. So now we've got gluten, we've got sugar, we've got caffeine, we've got all these things knocking their immune systems for a loop. And then we get a burst of warm weather and all the flowers come alive and they wonder why they've got this allergy response.
Yeah. We do ourselves a lot of harm over those couple months there. And people wonder, they come into this time of year. If you ever wonder why you crash on the weekends or, you go on vacation and you just crash or you get sick, it's because you're running on adrenaline the whole time. And that's what people do up through, the first of the year there. They're running on adrenaline, trying to make it through all these things. And then they get to the tail end of it and they've got nothing left to go on.
That's right.
And they haven't been feeding themselves, what they should be feeding. Their body is depleted on a lot of things. And it really makes that allergy response harder for the body. It can't cope quite as well as it should.
It can only deal with so much at a time. This is particularly true as we get older.
Yes.
We don't get better. We have to do more to just keep status quo.
And it's not so much the linear time aspect. It's just you've been beating yourself up for a
wear and tear.
Time. Yeah, it's just as we get older, as we get out of, not even now, I see these poor kids, they're so stressed out and they're in, like middle school, high school, and they're, you would look at some of their chemical profiles and you think they were a 50-year-old banker. As life goes on, we pile on more and more responsibilities. We get into our productive years and, we go all the time, and our health starts to diminish some.
It does. And this is another thing, people get upset because, well, I never used to get trouble with this. I never used to have this. Well, your body's different.
Yeah.
And with each decade, there's a major shift in what happens inside of us.
If you never changed the oil in your car, it never used to clank either. But
exactly.
It starts to.
And for some reason we think, we should all stay the same as we were at 30. But we'd like that.
That'd be great.
That'd be great, but it doesn't happen like that. And so you end up with more and more problems. We're going to take a break for a second, and we will be back very shortly. Welcome back. This is Dr. Tom Roselle Live, and this is Sue Roselle sitting in for Dr. Tom today. I have as a guest today Dr. Leonard Poe, one of our doctors in the office, and also the doctor at Core Concepts Chiropractic in Broadlands. And we will be doing a lecture on Thursday evening at Dr. Poe's office on spring allergies. And Dr. Poe, you want to give us the phone number to call for registration?
You can go to my website at core2chiro.com, or you can call the office number at 703-723-4178.
And for those who are listening today, if anybody has questions about things we're talking about or other things, you can get in touch with us at 888-630-9625. That's 888-630-WMAL. So, Dr. Poe, we were talking a lot about why people get allergies and why they respond to their environment and why when we get older it gets to be worse. The traditional way of dealing with allergies involves using a lot of medications and things like that. Do you want to expound on that?
Sure. I mean, that's kind of the typical medical model. You know, you take things. There's different pharmaceuticals that what they really do is knock down the immune system, so you just don't have a response. And you know, that's not. You know, there's a quality of life piece, but that's not really the best way to go about it. You want to. Like I said, we tend to look at the endpoint when we're already there. If we back up and we start looking at, well, how do we support and how do we normalize the immune system and get it to respond a little bit more appropriately, you know, that's a much better approach to take with that.
It's prevention rather than
prevention,
treat.
Yeah. It's, you know, and it, you know, we think it's impossible once it's there. But, I mean, last weekend, I mean, I was miserable. I mean, it hit me like a ton of bricks. We had that storm, and it did that for a lot of people where it was so much, so fast. And I was just, oh, God, I was miserable. Yeah. And it took a couple days to get it down and get it under control. But you can do it. You don't have to wipe out your immune system to do it. If you support it correctly and you work with it a little bit, it will respond in kind. Big thing is helping to keep some of those things out that are going to increase that response. And that comes back to the dietary piece we'll talk about in a little bit.
Exactly.
But, yeah, if you can stay away from those things, you want to stay away from those things. It's not good for you to take those things long term.
Well, and one of the things, too, with especially decongestants and things like that is, yes, it makes you feel better, and it does help you breathe better, but because your body's natural defense is to produce mucus to carry these annoying things out of your body, when you take the medications that suppress this particular thing, it drives the infection back into the body and keeps it there.
And we wonder why we get, you know, chest infections.
Exactly.
And these coughs that you can't get rid of for
the 5-week bronchitis that has no treatment for it except just to survive it. And so that's one of the concerns that I have about using a lot of the medicines. The other thing, with the possible exception if you're going to be on an airplane, I think that would be one time that perhaps it might not be a bad idea, but not to be used consistently, not to be used all the time when you are trying to just do your day-to-day living.
There's other ways to clear out that response. But yeah, you don't want to, you got to move the stuff. That's the big, you know, one of the therapies that we use in the office that I absolutely love this time of year is diathermy.
Oh yeah.
It's an old physiotherapy. But you know, one of the problems we have is that the lungs, your body doesn't have any way for your lungs to naturally warm themselves up. So we get in these pockets at this time of year where we have days like today, 40, 50 degrees, and then, you know, tomorrow it's 30. You know, or 20, you know, it goes back and forth. So we breathe in, you know, we get this warm air and it opens up our lungs and we breathe all this stuff in. And then the next day it's freezing and the lungs and the air, the bronchioles close back down and that stuff gets trapped and you can't get it out.
That's right.
And diathermy is this old physiotherapy that actually warms the lungs up. It gets it warm, it gets the mucous membranes moving, and it'll get that infection up and out. And, you know, I tell patients after we're done with this, you're probably going to cough more. Mm-hmm. You're probably going to, you know, but it'll be productive. You'll get stuff up. You'll get it out. And you'll get rid of this so it doesn't become an infection. It's a great therapy. It's one of my favorite therapies this time of year to use with patients because it works so well. It really clears out the chest.
It really does, and especially when they end up with that 5-week bronchitis that comes.
You just can't. You get that crappy little dry cough that you can't ever get rid of.
It just hacks and hacks,
and it's that little annoying.
And actually, what I've heard from most folks is that they cough for a little while right afterwards, and then they can suddenly breathe much better.
Yeah.
And
it burns out the infection.
They stop coughing at night when they're trying to sleep. So that really does help. But again, it works on getting the the junk out, which is really what your body's trying to do in the first place.
Yeah, it's a normal, that's the thing, it's, our allergy, it's a normal response. It's not a bad thing.
No.
It's just that it gets exaggerated for people because they've already got the membranes agitated, usually because of dietary habits, that's the biggest thing, or because of poor adrenal response, but those membranes are already agitated. And you don't want to stop that process just to make you feel better. You want to work with the body to make that process more efficient and make it work to your advantage. That's really the key.
And we've learned that suppression is what we should do, but it's really not what we should do.
No, you work with the body to fix it.
We'll be right back. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle Live, and we are at 888-630-9625. That's 888-630-WMAL, and we welcome anybody's phone call that might like to discuss either the topic we have today or something else related to their health concerns. Dr. Roselle's not here today. Dr. Poe, tell me a little bit about some of the things that you feel would be appropriate. We talked about, how medical approach may be more to suppress the symptoms, and we need to do more to prevent them in the first place.
Yeah.
Since prevention is always easier than the fix afterwards.
And yes, absolutely. And it's not too late. It's, even if you're starting to feel the allergies now, listen, we're probably in for a pretty long season. It's not too late to start doing some things now. The biggest thing that nobody likes to deal with, and honestly, it's the most profound thing you can do for you. If you really want to empower yourself, in your own journey of health, diet and exercise are the two biggest things.
They are.
And those are the two things.
But the codicil is don't exercise outdoors right now.
Yeah. The dietary piece is huge for allergies. I mean, that's really the biggest thing because when we're not eating right and when we're eating things that we're sensitive to, and I caution about using the word allergic to, because when we're talking about foods, we're talking about allergies, we're talking about that IgE kind of response, that real heavy mediated, the peanut allergy, the shellfish allergy, the kind of things that put you in the hospital.
Right.
It's not that kind of thing. It's food sensitivities. It's things that are going to tend to cause other kinds of immune reactions in the gut, other kinds of histamine responses in the gut. You don't have to be, you don't even have to be sensitive to it. Dairy just in and of itself, it contains histamine and has a huge histamine response. It makes you nasally.
Absolutely.
And so this time of year, if you're eating a lot of dairy products, and you're prone to some environmental allergens, it's going to be even worse. So the dietary piece is huge.
It is huge.
Is your piece.
And it's a very hard thing for people to have to get their head around trying to make these changes.
It's difficult because we've confused so many people.
Yeah.
I mean, everybody out there, there are like a billion, nutritionists on, YouTube and Facebook and
internet, and you could read one thing on one blog and another thing on another blog, and people come off completely confused because they don't understand how to do the.
And then not to talk about the lobbyist either.
No.
For the stupid food pyramid or
But you have to be able to see who did these studies that they're making all these claims from, and you don't hardly ever have that. So that's part of the source of confusion. But specifically, dairy, of course, is one of the biggest ones. And then the other big one is the gluten. And, there's a lot of information out there now that says gluten's overdone, it's overdone. And it may be that it's not the gluten, it may be the processing of the wheat products at the beginning, so we have to go back another step too. But we do know that a lot of times when people have sensitivities, their digestive system is upset, they have constant sinus problems, the sleep difficulties, they can't think, they have brain fog, you pull dairy and gluten out and all of a sudden a lot of these problems fix. Yeah. Or get significantly improved. Well,
exactly.
That's enough proof for me that those foods did not work well for that person. That's kerosene in their Mercedes, and it'll run, but not very well. And so that's one of the first things. And the other thing is, a lot of times people have sensitivities to the environment, and this goes along with why it happens as we get older, because their digestive tract doesn't work as well as it used to. One of the things that happens with the digestion is we lose our ability to create stomach acid, or worse yet, people are on acid blockers in their digestive tract, which prevents them from being able to break down proteins. Now, what that means is pollens and mold spores all have a protein component to it. And if you don't have the stuff in your belly to break that protein apart and get it to a point where it can be eliminated and properly processed out, it's going to cause irritation in the stomach, so people are going to feel nausea. It's going to cause irritation in their lower abdominal area, in their intestinal tract. They're going to find that they feel bloaty, that they feel gassy, that they either get changes in their bowel function, or things just don't work right. And they say, well, I didn't do anything different in my diet. Well, no, you didn't, but now you have a big, big overlay of a major irritant to the system, in addition to just surviving on a day-to-day basis with the usual. So that's part of where people get into a problem.
Yeah, and you got to remember, it's not, these are not separate systems. You've got one big mucal membrane from your nasal cavity and your oral cavity all the way through the entire intestinal tract. And it's not just a localized response. It's not like, well, just, that part of the stomach gets irritated when you put something in there that shouldn't be in there. It's the whole thing. The whole tract is going to get inflamed, and that includes your nasal passages and your oral cavity.
Absolutely. We do have a phone call this morning, or this afternoon. Sarah?
Hello?
Hi, Sarah, are you there?
Yes, I am. I wonder about, first of all, I will say about gluten. I never knew there was so much gluten in so many different things. All of a sudden, gluten's popping up everywhere, but that's beside the point. Soy. I notice so many of the vitamins have soy in, and I can't prove, never have had proof that I'm allergic to or super sensitive to soy, but I'm wondering if it could possibly be wise to cut back on nutrients that have a soy in them. Well, those would be like capsules, I suspect.
Is it an oil? A soy oil?
Yeah.
Yeah.
Yes.
Probably the soy oil won't have an impact on. A lot of people worry about soy and their hormone balance. It's not usually the oil that'll do it. It's usually the proteins. But the big thing about soy is it's one of the biggest genetically modified crops we have in this country.
Yes.
And if it is not an organic soy that's been used in a product, it's not a good thing. So it's not having an impact necessarily on hormones.
It'll take me a while to make the transition with all.
Well, your best bet is when you're looking at vitamins and so forth is to not go to Costco or BJ's or
Costco,
CVS and some of those. They're
at home, and they saw they had soy in it, and probably there's other things at Costco that aren't so good for you either. But I will slowly weed out and get more label conscious. I've just been so busy. I haven't been as attentive as I should be.
But that's one thing to be attentive to.
Okay, thanks so much.
Okay, thank you for calling.
I would look at when you see things in there, if you're using soybean oil or, you're using things like calcium carbonate, when you see those things in your supplement products, that kind of tells me it's probably not a good quality product. Those are just little things to look for because it's cheap.
It is. It's inexpensive.
Yeah.
And, there's some people who believe, if you're in your 20s, you can get away with the cheaper ones. Your body has the energy to change it. I'm not so sure that's the case anymore.
Yeah, no, I don't think so either.
I think people at all ages at this point need to be very careful about the form of nutrients that they use.
No, I'd agree.
Especially during allergy season.
Yes.
Because that could be another problem for the overload on the immune system. Everything that touches the body has to be processed. It has to be searched and surveyed by the immune system, and it has to be processed through the liver and the kidneys. And so with that thought in mind, you want to keep a focus on some of the better things to do to not put too much of a burden on those. Some of the other things that you use, neti pots and saline nasal sprays. Those are all very beneficial. It's like washing your hands.
Yeah, no, doing a good sinus rinse. I don't use the neti pots because that's
a pain in the neck.
Weird, yeah. But the Nelly Med bottles, the ones where you can like use pressure and but it'll drain out the sinuses the same way. I'm just not coordinated enough to use a neti pot, but anytime you can get in there and you can rinse the sinuses, you can drain them. It's one of the best things you can do for yourself this time of year if you tend to get those things inflamed.
Sure, because it gets some of the inflammation down, but it also washes out the irritants.
Yeah, it helps get rid of the irritants.
So they can't get stuck in there and continue to cause aggravation. Natural products. A lot of folks ask me about local honey.
Mm-hmm.
And I find that it seems to work for some folks.
It does. It depends.
You got to go to a good aviary.
It's got to be the raw, unfiltered. It's got to have the pollens in it.
From your neighborhood.
From your
Which is
your region where you are.
It's a little hard in Washington, D.C.
And you can start desensitizing yourself to that.
Right.
Actually, it's one of the things I actually sell. I have a patient that is a beekeeper in Hamilton, and I actually sell honey from his apiary there.
Mm-hmm.
And it's fantastic. I mean, it's like an old wives thing, but it really does work.
Mm-hmm.
I mean, it helps desensitize it. Like I said, it's one of those things you have to start with that early.
Yes, it's sort of like using homeopathic.
And it doesn't mean that you have like a jar of honey. It's, because sugar is sugar is sugar.
That's right.
But, you start, little, like a teaspoon of honey here and there. And
how early do you usually start people with that?
Well, if I'd known how this year was going to be, I probably would have started back closer in, January, February.
Okay.
That's the tricky thing about this. Why it's so important. Just take care of yourself to begin with.
All year round.
Because you never know, when spring is going to come early.
That's right.
And, this looks like a year where, again, we're going to have an early spring. It's not too late to start. You're better off if you had started like a month ago. But you're not too late to start now.
Mm-hmm.
There's lots of things you can start doing for yourself now because you got to remember two different things come into bloom at different times.
Right.
So the stuff that's affecting people now, it's going to be different stuff that affects other people a couple weeks from now.
And we don't have the yellow haze in the air yet.
No, not yet.
That's coming, and that's when people will really be feeling it. So
right now it's a good mix. There's some tree molds and there's a lot of tree molds. There's some tree pollen, but then there's also some molds that are
lots of
right
mold.
Now too. Yeah.
And so this would be a good time to start doing that. The other thing is probiotics.
Mm-hmm.
Digestive
that
enzymes.
comes back to you keep your gut healthy.
Yeah.
You keep that part of the mucous membrane healthy, and it really lessens what the nasal cavities take on.
Well, it's 80% of your immune system is in that intestinal tract.
Yeah.
And it has a direct line of communication with the sinuses, which, here your intestinal bone is connected to your nose bone, I guess. But if the intestinal tract is doing well, if the digestive tract is doing well, you will have less trouble with your sinuses and less trouble with allergy reactions and all the things that go along with it. It's not just sinus infections and pressure in your head. It's also the fatigue that goes along with it and the brain fog that goes along with it. And people they literally can't remember their names sometimes if the allergies get so bad. Rashes, itchy.
And that comes back to, again, so the two big things, your digestive function, how well it works, and then adrenal function, and how well your body's able to respond to that inflammatory process. The digestive function piece of it, that's also, when you talk about the hydrochloric acid in the stomach and how much of it you have and you're supposed to have, as your stress level goes up, that tends to go down.
Yes, it does.
And that's another big segue for people this time of year. They just don't have the stomach acid in there to protect themselves from the proteins and the pollens and the molds and things like that.
So you have a bad diet, too much stress, no exercise, not enough sleep, and your digestive tract doesn't work.
And you're going to have allergies.
Gosh, do you think allergies are going to happen?
You're going to have allergies, and it's going to be worse. And if you don't do something to fix it, it's not going to get better. It's just every year it's going to get worse and worse and worse.
And I think the recuperation becomes less effective between pollen season, so that people start out with, well, I just have spring pollen. Then pretty soon they start having summer weeds and grass. And then pretty soon the dog in their house is starting to cause trouble. And then the cat in the house is causing trouble. And then ragweed comes in August, and mold comes from the whole summer. And pretty soon you've got a person who's sick 24/7 all year round.
And you see, and like, it's not, these things were always there. It's not that there's something new there in the environment. All of a sudden I'm allergic to no. It's your immune system is crashing. It's just descending and descending and descending, and it can't keep up with anything environmentally anymore.
And I think that that's something that people need to realize is, if you find allergies are getting worse from year to year to year, that's really a red flag.
Yeah.
That's really saying, hey, listen up. What you're doing for yourself isn't working, and your body is starting to go down. Now, allergies are annoying, and they're uncomfortable, and they're unpleasant, but they're not life-threatening. But it could be indicating that the immune system is struggling so much that it cannot prevent the body from the things that are life-threatening.
Correct.
Because now it's being tied up in doing environmental management, and it can't do the other things it's supposed to. So really, allergies can be considered to be a red flag of something deeper and possibly more sinister if people don't take heed.
It can lead to lots of things. This is a time of year, too, where I tell, so many of my patients that have autoimmune problems, you need to see how your body's going to react this time of year. Is this going to cause an autoimmune flare for whatever you have? When our immune system ramps up to try to deal with these allergies, it ramps down to deal with other kinds of infections. So it creates this, this unbalanced kind of immune approach, and that's when that's why people bounce back and forth. I have allergies and then I get sick, and then I have allergies and I get sick, and it goes back and forth, back and forth. But when we see that back and forth, this is when people also tend to have those autoimmune flare-ups. So if you've got things like RA or lupus, or the ones that you can have, very easy on the surface symptomatology for, if your allergy season kicking up and you're noticing you're waking up and your hands are hurting, that kind of tells you where your immune system's getting beaten up and how it's driving it. And that's an important thing to look at, when you look at yourself globally, systemically for your whole health. This is another time of year to look at that, to see how do these impact my immune system. It's a great kind of tip to be able to pick up on.
It is, absolutely. So if you recap, the best ways to deal with this sort of thing, obviously, is to get your diet back in place.
Diet's the biggest thing.
Get be conservative with alcohol if you choose to use it. Get the sugars out. Sugars slow down the immune system immensely and prevent the body from properly functioning. It's also stress to the adrenal system. Get the proteins in. Don't go long times without eating. Don't eat junk food to make up for not having decent food. Common sense stuff. And get chiropractic care. I am a big fan of that. Boy, I used to be allergic to September, and I'm not anymore. And I can say it's diet change and all the good care I've had over the years. We are about to leave for a moment, and we will be back very shortly. Stay with us.
105.9 FM and AM 630 WMAL.
Welcome back to Dr. Tom Roselle Live, and my guest today in the studio is Dr. Leonard Poe, and he and Dr. Roselle will be doing a lecture Thursday evening at 7 o'clock at Core Concepts Chiropractic in Broadlands. And Dr. Poe, phone number again?
It's 703-723-4178, or go to my website to register, corechiro.com.
So we have a phone call on the line. Keith? Keith, are you there?
Yes, I am.
Hi. Welcome.
Thank you. I'm 60 years old, and I have suffered from allergies to pollen. I'm allergic to every pollen in the Washington area. And so, it started when I was a teenager, and when I was in my 30s and 40s, I was having sinus infections like 2 or 3 a year. And then it even developed into a fungal infection. So once I was treated for fungal infections, it settled down, and I didn't have any problems. Now, after that, I had a surgery. And after the surgery, I developed food allergies. Mm-hmm. And maybe I should come in and see you guys. I'm tired of doctors. You go in and they give you a pill and tell you to go home.
Right.
And I've always wanted to try to treat this somehow homeopathically, and I don't know if there's any recommendation for you that you could give me over the phone.
Well, other than having sensitivities to foods and possibly other environmentals after surgery makes sense, because surgery is a huge hit to the body. It's a tremendous burden to the system to try to repair that crisis. So that would make sense. Keith, if you'd like to touch with any of our doctors, our phone number at Roselle Center is 703-698-7117, or you can send an email to rosellecare.com. And one of our doctors would be happy to get back to you. I don't have a lot of time to continue talking today, but I appreciate your phone call, and if we can do anything to help you, I would appreciate it.
I appreciate talking with you. So.
Our pleasure. Dr. Poe, so tell me what we're going to talk about Thursday night at your office.
So some of it's going to be, kind of along the same lines as what we're talking about today, since we're talking about allergies. But the other pieces we want to get into, and Keith, you might be interested in this, what can you do about it? And, that's where it's hard to give out advice for stuff like that.
It is.
Because, there's so many different pieces to the puzzle. You got to look at the structural pieces. How big are your sinus cavities? Some people just naturally have smaller sinus cavities, and you've got to keep those things open. You got to keep all the inflammation out. What are some of the real basic, herbal remedies, homeopathic remedies? Will any one of these things work? No. And that's why I always caution people. You can throw out things like stinging nettles or quercetin or things like that. Are they going to work for you? Maybe you're lucky, and that's all you need. It was a little bit of that. But usually people have 2, 3, 4, 5 other things at play at the same time. So we've got to talk about the immune system as a whole. We've got to talk about, those structural pieces and how well you drain. We've got to talk about the dietary pieces and how well you're digesting. There's all these different pieces to the puzzle.
And what you choose to digest.
Yeah, and what you choose to digest. Do you already have bacterial or fungal loads, systemically inside you? Do you have other things beating up your immune system that are making this allergy problem worse than what it already is? So that's part of what the program on Thursday is going to be about, is taking this, this big picture look at you, this global view of you, to say, it's not going to help if I just do the one thing.
Exactly. I
have to do X, Y, and Z all together at the same time to really start to see that difference. And that's really with any problem, whether you're talking about allergies or anything else, it's just that investigative process of a person to figure out, okay, what are all the missing pieces here? What are all the different puzzle pieces that you got to put together? What are the 5 things you got to do at the same time? And then you feel relief, and then you start to feel better. So Thursday we'll kind of go through and we'll pick apart a lot of those different pieces. And so, when you're there, you can start to see, okay, that's me. Okay.
So there's actually lifestyle changes that will make the difference.
You can see, there's parts that we can help you with, and there's parts that you have to help yourself with.
Right.
And the help yourself with parts are always the hardest parts to do, because that's truly lifestyle. And but at the end of the day, that's what we're really about, is it's lifestyle change.
But often when people have the information of what that lifestyle needs to be to change and to alter what they're currently doing, it makes all the difference in the world.
The educational portion, and that's why we do the radio program. That's why we do the lectures.
Absolutely.
They're free of charge. There's no cost to them.
That's right.
It's to help educate you better so that you know what to do to yourself to help improve your health.
And most of the time, it comes back to, if you have the tools to use, you'll use them.
You'll use them.
I appreciate your being with us today, Dr. Poe. Look forward to your lecture on Thursday evening, and glad that everybody was able to hear about what you're talking about, and hopefully we can come up with some solutions to help get through this difficult season, which may end up being one that's carried on through
It'll last
the rest of the year. We'll see you later. Bye.
See you later. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.